Good afternoon. I'd like to welcome everyone to the Postnatal Depletion and the Four Pillars of Health webinar series. My name is Alexandra Sampson, and I am the owner of MOMinar Fitness. And we are delighted that you are joining us for today's series. If you're not familiar with MOMinar Fitness, I would love to give you a little bit more information about us. We are a fitness company that celebrates women wearing dual hats as mothers and careerists, and we're devoted to addressing the obstacles working mothers and really all mothers face in trying to stay fit while balancing their family life and their professional lives. And we accomplish this goal by taking on a number of different activities. You know, we provide a lot of fitness information through our website. We also provide fitness events such as the webinar that you're participating in today, along with additional programming such as exercise programming like boot camps and fit camps and other events, really to serve as a forum for moms to network and support each other as we wear multiple hats. So we are kicking off this month-long series on postnatal depletion, and today we're going to hear from Dr. Christina Liparini, who is going to actually kick off the session with a general overview of what is postnatal depletion and the four pillars of health that are so essential in combating it. But I wanted to briefly set up the speakers for the rest of the series, and we're hopeful that you will join us for all 5 sessions. If you're not able to join us for the complete series, at least not live, each session will be recorded, so please look out for emails that contain information about how to access the recorded versions. But after our kickoff, we will go each week into each of the pillars of health. Next week, we will have a session on sleep and its importance in combating postnatal depletion. That session will be conducted by Terry Crawley, who's a registered nurse and certified sleep education specialist. And she's a representative with the Better Sleep Council. The next week will be followed by a session on purpose and really maintaining a sense of self. And of the 4 pillars of health, I believe this is the one that most women don't pay enough attention to. I think we're generally aware that sleep and exercise and nutrition are important aspects of our overall health and wellness. But I think so often we don't really remember to take care of ourselves and actually maintain our own sense of self-identity. I think a lot of times we become encompassed by the different roles that we're playing as mothers, maybe as wives, as employees, and sometimes lose sight of the things that are important to us as individuals. And so Jen Roberts, who is a certified career and leadership coach, is going to do a session for us on that topic. I will do a topic our next week on exercise and really providing some practical tips on ways to find time to fit in working out and exercising in a busy schedule. And Cheryl Harris will conclude our series with a session on food as nourishment, really delving into nutrition. Cheryl is a registered dietitian and has a wonderful practice on that topic as well. So again, just a highlight of what I call the dream team for this postnatal depletion series. So at this time, I'm going to actually kick over the program to Dr. Christina, who is going to explain to us what exactly is postnatal depletion and why is it so important for us as women and as mothers to pay attention to this topic and some of the ways to combat it. So at this time, I'm going to turn the program over to you, Dr. Christina.
Okay, great, Alex. Thanks for having me as part of the dream team. I'm happy to be on board, and yeah, I'm really personally and professionally invested in this topic, and let me just get back to that slide. I think when we think about postnatal depletion and what it is, one of my favorite actresses, Tina Fey, said it really well in the movie Date Night. I think it's a great picture of being depleted when she talks about her fantasy is not having an affair, but sitting in a hotel room in the air conditioning by herself, eating her own lunch with no one touching her, and just drinking a Diet Sprite by herself. So I think it's a good picture of how we can get depleted as mothers, and self-care and even those small things can go by the wayside. So as I mentioned, I am personally invested in this as well as professionally. Professionally, I am the owner of Women's Reach LLC, which provides psychoeducational programming and individual counseling to women with a focus really on women during the childbearing years. We all inhabit so many roles, and my job is to really help you feel good about the roles you're in and meet you where you are. As part of meeting you where you are, I also aim to have services that are accessible. So online workshops and programming, as well as in-person workshops and individual counseling. So hopefully my services are going to grow and become even more accessible to women. Personally, just to tell you a little bit about myself, I am the mother of an almost 4-year-old who is at his grandparents today, so I can talk uninterrupted for 15 to 20 minutes. I'm also an educator. I'm adjunct faculty at Seton Hall University, where I teach in the online programs for counseling and school counseling, which is a really great, flexible job I'm very lucky to have. And let me see, I'm sorry, I'm just trying to get this slide up so I can see the rest of it here. I'm also a psychologist, as I mentioned, with Women's Reach. And like many of you, I also have a slew of other roles, whether it's wife, sister, blogger, volunteer, friend, patient. And that last one is what really attracted me to this idea of postnatal depletion. And just to tell you a little bit about what happened to me personally that brought me to this idea of postnatal depletion. There was a year when I wasn't really in the picture. I was pretty sick. I was very depressed. My son was about 2.5. I had some pre-existing autoimmune conditions which flared for me. And I was sick for several months, just back to back, very tired. I had significant weight loss. I withdrew from friends and family in a way that I never had before. And any energy I had was put into my son, just getting through the day with him. I couldn't concentrate. And as Alex mentioned, that overwhelming symptom of I really just, I lost myself in the process. So today's session, I want to talk to you a little bit about what exactly happens when we are depleted. So present to you a little bit about the context that we're in where that happens, as well as all the factors that can lead to it, the symptoms of depletion, and then talk very briefly about the approach to confronting and treating the depletion, and very briefly talk about some tips to get you started on your journey. So let's talk a little bit about the environment today that we as women, especially mothers, find ourselves in. One of the big factors that I wanted to cover was time pressure and multitasking. As a mom, the average mom is putting in 20 hours more per week than her partner, whether or not she's drawing a paycheck. And after a baby's born, the time stress goes way up for us. Fathers only experience about 1/3 of what we experience as far as the time stress. So even if dad is pulling his weight at home, our stress doesn't dissipate. The time stress goes up whether it's our first or third child. And if you already have a toddler at home and you have a baby, that time stress goes up even more. This next fact was a little demoralizing for me, but it also rings really true that mothers, we spend more than half of our waking hours multitasking. And how about this? We do about 5 things at once, okay? And we're also probably planning about 2 things while we're doing those 5 things. So our plate is definitely full. It's been described as constantly feeling slightly jet lagged, okay? Our time is more fragmented than our partners, right? We're switching back and forth between our kids, if we're working, home, all the executive functioning that goes into running a home. All of these gear shifts require attention, which is absolutely exhausting. And it's no surprise that women, in particular mothers, are the fastest growing group being diagnosed with ADHD. In one of the books I read that I referenced in this presentation, Overwhelmed, the author, when she spoke to professionals about this and inquired about it, they said it's not so much diagnosis ADHD, so much as diagnosis overwhelmed. There's less social support, right? So we don't have as much family and social support as we had in the past. Maybe our parents did, or our parents' parents. We don't have that close-knit family structure of intergenerational support. Our aunts, our mothers, our grandmothers, our cousins are not raising their children alongside us, and we can't share the mothering duties with them. So our demands are going up once we have kids, but our resources aren't. The increased number of roles that we have, 2/3 of mothers with children under 6 work, okay? And we're juggling lots of hats, as I showed you in my previous slide. Those are my roles, and I'm sure I forgot a few. So we're juggling lots of roles, and there's increased demands within and among those roles. So consider the mother who's working, of juggling that multitasking, right, of switching attention and the time pressure. In addition to that, pressures in the workplace, that there is definitely a motherhood penalty for those of us who are working, and a caregiver bias at work when we're talking about pay, promotion. That merits its own webinar altogether. Okay. We're also competing with the ideals of motherhood, right, that we should be enjoying all of the tasks of motherhood, that we should want to play with our child all the time, that we should love getting up in the middle of the night in that special time, and everything should be, whether it's everything should be homemade and we should be on every committee, the ideal of the perfect mother, and contending with that. There's also absolutely some biological factors that play into depletion, such as having a child later in life. We're more prone to fatigue and illness once children arrive, and with more of us waiting to have children later in life, there's less time to restore our hormonal equilibrium before menopause, which is important. If we're waiting later and having children closer together because of that time pressure of that clock ticking, we don't get to really fully recover after childbirth before getting pregnant again like we used to. And of course, with reproductive technology, we're getting more twins, although hopefully that is, changing the trends there. But with twins, double the pleasure, but double the work. So keeping that in mind as well. And I'll defer to Cheryl in the upcoming webinar as far as nutritional deficiencies, but just making the point that going into pregnancy and conception even, a lot of us are already depleted in vitamins and nutrients. And then during pregnancy, we're giving everything that we need to this growing baby. Coming out of that, we're even more deficient and lower in reserves of important fats and proteins and amino acids. So I don't know about all of you, but sometimes finding ourselves leaning towards, convenient, nutrient-poor food, not getting solid meals each day. I try to follow an autoimmune diet, and I'm not supposed to have potatoes or sugar or tomatoes. And last night I polished off all of my son's French fries that were still on his plate because I was just tired and looking for quick energy. So keeping that in mind, again, nutritional deficiencies. Genetic predispositions. Some of our relatives may have had illnesses with their endocrine systems or obstetric complications that raise our risk for similar problems. Okay. Or we may have entered motherhood already having pre-existing conditions. The bad news being also that women tend to have higher rates of allergic and autoimmune conditions. And as far as the latter, they tend to occur in clusters. So maybe not having just one autoimmune condition, but several at the same time. And then, of course, after motherhood, developing such conditions. We know now that chronic stress really affects all of our systems, including the endocrine system, raising our adrenaline and cortisol, which can lead to inflammations, infections, and autoimmune disease. And I'm really excited that Terry is going to be talking to all of us about the importance of sleep, because it is so important, and we are so deficient in this area. In fact, during the first year of a child's life, we as mothers have about a 700-hour sleep deficit, and although it gets better, we're still lagging in future years with about 500 hours of lost sleep each year. and the quality of sleep we're getting during those 6.5 hours a night is not of the deep quality that we need to be restorative and keep all of those neurotransmitters humming along to regulate our mood and other physiological functions. And my favorite topic, the psychological influences, since that's what I do day in, day out, talking about depression. So some women, already have a tendency towards depression going into motherhood, and this can be obviously influenced and intensified by the hormonal fluctuations of motherhood. In fact, we now know that the peak for depression postpartum is not in that first year, but really year 4. So when the child is a bit older, that mother's depression tends to peak. About 1 in 10 women will have postpartum depression, and if you have it with one child, it increases your risk. It triples, in fact, your risk of having postpartum depression with future children. And lots of feelings that can lead absolutely to that depletion. Feelings of feeling isolated, insecure as our role of mother, unworthy of that role, feeling chronically overloaded or stressed. And if you are a mother with a high need for control or orderliness, it might be more difficult when you actually have children that don't like control or orderliness. So that tendency in you, especially if you're matched with a child with a different or difficult temperament, can make motherhood more challenging and lead to depletion. Most of these already about the social factors that can lead to depletion, like that lack of strong community nearby. And we really also don't belong to as many groups as our parents used to. That could be practical support for caregiving, but also buffer us from the health consequences of stress. We belong to about 1 community group, whereas our parents used to belong to 5 or more. So our social support is definitely lacking. And as I mentioned, the disparities between workplace and home. So what is postnatal depletion besides what Tina Fey told us? Postnatal depletion, or whether we call it postnatal depletion or depleted mother syndrome, it's basically a constellation of symptoms that mothers can present with. And I'm giving you 2 different models. The one that really spurred this webinar was the one proposed by Oscar Serrallach, who was cited in a group article. And I just wanted to point out, looking alongside that Hansen and Polycove, back in 2002, wrote a book called Mother Nurture that talked about many of the same symptoms. So this is nothing new. There's a lot of similarities. So rather than running through each bullet point for each model, you can see that both really talk about an overlap in the actual symptoms, and that there's multi-factors. It's multifactorial, that there are a lot of different influences, the biological, social, psychological, that come into play, and that it's cumulative. So it's not as soon as a child is born, but perhaps maybe year 2 through 4, depending on which model we're looking at, where it peaks. We don't know exactly how many women that it does hit, because it depends on which mothers are actually seeking help. So we don't know all the mothers that are struggling with this. The good news is that it typically decreases as children reach school age, and the day-to-day demands on us as mothers tend to decrease at that point. So, but again, we're looking at maybe year 2 through 4 of when it's peaking. The symptoms you can see are also pretty similar, that there's definitely fatigue as the top one for both models that we're looking at, as well as feeling overwhelmed, the feelings of guilt or shame, the loss of self-esteem, social isolation. I like Hansen et al.'s model because it also really highlights the impact on relationships, especially with your partner, the tension and conflict and poor communication, the breakdowns that can happen in that relationship. Both models also talk about a comprehensive approach to recovery from the depletion, that it's going to take time, and that that comprehensive approach is going to rely on different providers to have full recovery. Hansen et al. Also talk about combining Western medicine with alternative techniques like acupuncture. And both Serrallach and Hansen et al. Talk about selective tests, like for nutrition, of looking at different levels of like vitamin D as being an important part of treatment. And Serrallach came up with a really nice model with the acronym SPAN to talk about recovery. And those 4 pillars are sleep, purpose, activity, and nutrition. And Terry, Jennifer, Alex, and Cheryl in the coming weeks of our webinar series are going to cover those in more depth. But just to give you an overview of all the different areas when I am talking about comprehensive treatment, that this is what it's going to look like. So let's talk about some tips while you're on your journey to recovery. The first tip that I would have is finding ways to de-stress, finding the time. You do have time. I have time. It may be 5 minutes here or there, but I can either choose to check email or check TMZ online, or give myself 5 minutes to de-stress in a more quality way. I've incorporated it in because I found that my health really does depend on it. So finding that time, I do mini breathing exercises that take just a couple minutes. Nobody even knows that I'm doing them. I can do them while I'm driving. I can do them while my son is playing Legos in the corner. It's kind of like my doctor, or I think I read an article somewhere, you could do Kegels and no one knows you're even doing them. It's like you could do a mini and no one knows you're even doing it. Patience, you didn't get depleted in a day, and the process of coming back to your full health is going to take time too. And it may also include setbacks and challenges, and that is going to be part of the journey. I wanted to normalize that for you, and really encourage you to seek out social support. Remember, we want to increase that social support. You have more demands. Now you need more support. Finding someone, whether it's another professional or a friend or fellow mom, to work with and anticipate some of those setbacks or challenges together so that you can plan proactively for how you'll address them. Get in your head in a good way. A lot of times we kind of get these automatic negative thoughts that we don't even notice in our head, but in a good way, recognizing them, those negative thoughts, without judgment, and really catching them and trying to create them, move them into something that's more realistic and helpful, like the all or nothing or perfectionistic thinking you might have. Like for me, it was, I either meditate for 30 minutes or it's worthless. Well, I meditated for 10 minutes this morning, and it was more than I did yesterday. So, being happy with that. It doesn't have to be perfect. And coupling with that, the could, should, or must thinking that we all get into of, if you hear yourself talking to yourself with those words, you might want to, investigate further of how helpful that is for you. This author Burns of Feeling Good, it's a great book, talks about shoulding all over yourself. So if you are shoulding all over yourself, taking a closer look at that. One of the things that's been most helpful for me in my journey is developing my own vision of what is a good enough mother. Our children don't need us to be perfect, and in fact, they learn more from us when we're imperfect, and they see us learning how to cope with that and learning how to take care of ourselves and address setbacks or challenges. So keeping in mind that we just need to be good enough. And last but not least, don't be afraid to advocate for yourself. This may mean when you're working with medical or other professionals that aren't listening to you or answering your questions with one foot out the door, that maybe you need to fire them and find another provider that's going to work with you and have you as an active participant in your own care. So again, not being afraid to advocate for yourself. I have fired doctors. I have found the right team for me, and I really encourage you to do the same. And in closing, just keep in mind that, as Jan Hansen in Mother Nurture said, nurturing a mom doesn't mean doing less for her kids. When mothers improve their health and well-being, they are more able to be highly loving and skillful parents. And just to add to that, aside from being better and more present for your kids, I encourage you to nurture yourself so that you're able to be more highly loving for yourself. So thanks for being a part of this webinar kickoff with me. If you need to speak with me further or have any questions, here's my contact information. I'd love to hear from you. And at this point, I'm going to kick it back to Alex for questions and talking a bit about the rest of the upcoming webinar.
Perfect. Thanks so much, Christina. What a great overview. And, I think this is a really great start to the topics that we're going to get into over the next few weeks. It's good to be able to look at some of the factors and the things that we can identify with in terms of, we know how we might feel in terms of exhausted or tired or some of the other symptoms that we may feel as mothers. But really being able to now take some time to think about, well, what are some ways that I can improve upon some of those symptoms? And so we'll definitely get into those in the coming weeks. Before we move on, we have about 4 minutes left, and so I wanted to open it up for questions. If you are using or accessing today's webinar through Google Plus, through the Mommy Track Fitness event page, you can, there should be a Q&A box on, the slide says the left side of your screen, but it's likely on the right side of your screen. You can use that box to submit any questions that you would like to ask Dr. Christina. If you are not using the Google Plus event page, so you're either accessing it via YouTube or the Mommy Track Fitness website, you can send an email to info@mommytrackfitness.com with PD webinar question in the subject line, and we will receive your question that way. But we actually have one question that we received in advance of today's webinar. So while our participants are thinking of their questions and submitting them, I'll go ahead and pose this one to Dr. Christina, which is, and looking at postnatal depletion and looking at the 4 pillars that we're going to be talking about over the next few weeks, what is your recommendation to women that might feel a bit overwhelmed and trying to make a number of changes, in their lifestyle? So, if a woman is not getting sufficient sleep, but then she's also not working out enough and her diet's not the best, it can be a bit overwhelming to want to focus on all of those, those different areas to improve upon at once. And so what is your recommendation to moms that are looking for ways to maybe change current habits or change, their current situation, but, are a bit, the changes seem a bit intimidating?
Sure, I think that's a great question. And my immediate thought was, sleep is so important for giving us a foundation. It regulates our mood, our mental clarity. So it gives us a position of power to make, additional decisions about our care. So I think if you're looking for one place to start of looking at sleep hygiene, that can be a really great start. But overall, just keeping in mind too, that there's such a strong mind-body connection. So whether you're starting with a psychological symptom or a physical symptom, you might see improvements in another area as well. So not getting too caught up in exactly where you start of, trusting yourself a bit of what's most pressing to you, what's of most concern, what's impacting the quality of life the most, of starting somewhere. And I think that's important overall too, of just starting the process of linking up with someone that you trust, a provider that maybe you already know, and getting some help getting started. So, overall, just get started, I think would be my overall suggestion in the process. It's difficult to get started seeking help, especially for moms. There's a lot of stigma. We're supposed to be able to handle everything. So that one step is going to take a lot of energy anyway. So start where you feel comfortable.
Thank you for that. Okay, well, with that, we have 1 minute left. So before we conclude today, I want to give a quick, preview to what's coming. Dr. Christina has talked about these topics today, and so have I, so I won't spend too much time on this, but we do have 4 more sessions in this series. Each of them are going to be held on Wednesday at 12:30. They're only 30 minutes in length, so short enough that if you're working, you can grab your lunch and tune in. If you're at home, hopefully it's maybe nap time about now, or even if it's lunchtime for the little ones, you can have this playing in the background. But next week, we're going to be talking about the role of sleep and postnatal depletion. And the week following, again, purpose with the session, I Remember Me, really focusing on your maintaining your sense of self and redefining what your goals are as a mother. The following week, we'll be getting into exercise and how to fit it into a busy mom schedule. And then we'll conclude at the end of the month with food as nourishment, really focusing on the role of nutrition and just our overall health. And for more information about the series, you can go to mommytrackfitness.com/events, and you will see the postnatal depletion webinar series there as an option. Again, thank you so much for joining us today, and have a great afternoon.